Welcome, I'm Dr. Robert Glatter, medical advisor from Medscape Emergency Medicine. Today we have Dr. Paul Christo, pain specialist, Division of Pain Medicine, Johns Hopkins University School of Medicine, and host of the national radio show Aches and Gains on SiriusXM Radio, joining us to discuss the ongoing and worsening fentanyl crisis in the U.S. Welcome, Dr. Christo.
Thanks so much for having me.
I want to begin with a sobering statistic regarding overdoses. There were over 107,000 overdose deaths in the U.S. from 2020 to 2021, of which over 2/3 involved the synthetic opiate fentanyl, based on recent data from the CDC. So let's start by having you explain how deadly fentanyl is in terms of its potency compared to morphine and heroin.
Well, fentanyl is considered a synthetic opioid. It's not a naturally occurring opioid like morphine, for example, or codeine. This drug, fentanyl, we use a lot in the anesthesia world. I mean, we've used it for many, many years as an anesthetic for surgery very safely. And in the chronic pain world, we've used it actually for many years to help reduce chronic pain in the form of a patch. What we're seeing now, though, is something entirely different, which is, the use of synthetic fentanyl as a mind and mood altering substance for those that don't have pain. And it's essentially those that are buying this off the street. Fentanyl is about, 80 to 100 times more potent than morphine. So you can put that in perspective in terms of its danger.
And so let me have you take us through an evolution of the opioid crisis from the 90s, from long-acting opioid OxyContin, when it was approved in 1995, to where we are now. There are different phases. And if you could educate our audience on how, again, we got to where fentanyl is now the most common opiate involved in drug overdoses.
Well, it really stems from basically the epidemic related to chronic pain. I mean, we have over 100 million people in the United States alone who suffer from chronic pain. And most chronic pain, sadly, is undertreated or untreated. So in the 90s, in the quest, I would say, to reduce chronic pain to a better extent, we saw more and more literature and studies related to the use of opioids for non-cancer pain, for example, for low back pain. So there were a lot of primary care doctors and pain specialists too who started using opioids probably for patients who didn't really need it. And I think it was done out of good conscience, in the sense that, they're trying to reduce pain. We have other methods of pain relief, but we needed more. So at that time in the 90s, we had a greater use of opioids to treat non-cancer pain. And then from that point, we transitioned to the use of heroin. And again, this isn't among the chronic pain population, but it is sort of the non-chronic pain population starting using heroin. And then today we see synthetic fentanyl.
Right. And so obviously, with fentanyl being, the most common opiate we're seeing, we're having problems trying to save patients, and we're trying to use naloxone, but obviously in increasing amounts. And sometimes it's not adequate and we have to intubate patients. In terms of addressing this issue of supply, the fentanyl is coming from Mexico, it's coming from China, it's manufactured here in the United States. How do we address this crisis? What are the steps that you would recommend we take?
Well, I think that we need to better support law enforcement to crack down on those who are manufacturing fentanyl in the United States, and also to crack down on those that are transporting it from say Mexico, because I think it's primarily coming from Mexico, but from outside the United States to the United States. So I feel like that's important to do. And then two, I think that we need to better educate those that are using these mind and mood altering substances. And we're seeing more and more that it's the young adult population, those that are between the ages of 13 to 25 that are starting to use these substances, and they're very dangerous.
Right. Now, are these teens seeking out heroin and it happens to be laced with fentanyl, or are they actually seeking fentanyl? Are they trying to buy the colorful pills that we know about? What's your experience, in terms of the population you're treating and what you could tell us?
I think it's both. So we're seeing young adults that are interested in the use of fentanyl as a mind and mood altering substance, but we're also seeing young adults and adults too Use other drugs like cocaine, like heroin that are laced with fentanyl and they don't know it.
Mhm.
And that's, exponentially more
Right.
dangerous.
People are unaware that there is fentanyl in what they're using, and certainly leading to overdoses and deaths. I think that parents really need to be aware of this.
Yeah, for sure. I think we need better educational methods in the schools to educate that population that we're talking about between the ages of say 13 to 25. Let them know of the dangers because I don't think they're aware of the danger and how potent fentanyl is in terms of its lethality, and that you don't need very much to take in a form of a pill or to inhale or to inject intravenously to kill yourself. So that is key, education at that level. And also, I think to let those that are going to use these substances, specifically synthetic fentanyl, know that they should consider the use of fentanyl test strips. Fentanyl test strips would be primarily used for those that are thinking that they're using heroin, but there may be fentanyl in there, right? Or methamphetamine, or there may be fentanyl, and they don't know. So that the test strip gives them that knowledge. The other harm reduction strategies would be the use of naloxone, known as Narcan. I mean, that's a lifesaver. You just have to spritz it into the nostril. You don't do it yourself if you're using the substance, but you've got others who can do it for you. But no question, that's a lifesaver. We need to make sure that there's greater availability of that throughout the entire country. And we're seeing some of that in certain states. That is, that in certain states, you don't need a prescription to get naloxone from the pharmacy.
Right, and I think that's so important, is that it should be widely available. And certainly the COVID-19 pandemic exacerbated the number of overdoses we saw. Are overdoses coming down, or are we still at a level that's close to 2020?
Well, unfortunately, I think we're still seeing the same level, if not seeing it escalate. So, certainly the pandemic, because of the economic cost, if you will, associated with the pandemic, loss of employment, underemployment, as well as the emotional stress of the pandemic, I think led a lot of people to use substances on the street, in order to cope. So they're coping mechanisms. And we really haven't seen it abate quite yet.
Do you have a message to lawmakers on Capitol Hill on what we can do regarding the illegal manufacturing and distribution, how we can really crack down? Are there other approaches that we could really implement that might be more tangible?
Yes. I think number one would be to support law enforcement. Two would be to create and make available more overdose prevention centers. The first was in New York City. And if you look at the data on overdose prevention centers, say in Canada, for example, I mean, they've seen a 35% reduction in overdose deaths. These are places where people who are using can go to get clean needles and clean syringes. And this is where they got people who were basically oversee the use of the drug and intervene if necessary. It seems sort of antithetical. It seems like, well, boy, why would you fund a center for people to use drugs? But the data from Canada and actually outside Canada is such that it can be very helpful. So that would be one of my messages to lawmakers as well.
Do you think that the legislators could approach, some of these factories as a way to crack down, have law enforcement be more aggressive? Is that another possible solution?
It is. I think law enforcement needs to be supported by the government, by the Biden administration, so that we can prevent the influx of fentanyl and other drugs into the United States, and also to crack down on those in the United States who are manufacturing these drugs, synthetic fentanyl, first and foremost, because we're seeing a lot of deaths related to synthetic fentanyl.
Right.
I think also what we're seeing, and this is pretty intriguing, I think, and interesting, is the use of vaccines to help prevent overdose. The first human trial is underway right now for a vaccine against oxycodone. And not only that, but there are other vaccines that are in animal trials now against, say, heroin or cocaine or fentanyl, actually. So I think there's hope there that we can use vaccines to also help reduce deaths related to overdose from fentanyl and other opioids.
Do you think this would be given widely to the population, or just only to those sort of at risk, higher risk?
Yeah, I think so. It would be probably targeting those that are at risk, that are higher at risk, that have a history, certainly, of drug abuse. I don't think it would be something that would be given to the entire population. but it certainly could be effective, and we're seeing encouraging results from the human trial right now.
That's very intriguing. And I think that's something that certainly could be something that's quite helpful in the future. One thing I did want to address is that law enforcement, first responders have been exposed to dust or inhaled dust possibly, or had maybe fentanyl on their skin. And there's been lots of controversy. And I think that recent literature has dispelled the controversy that the people that had supposedly passed out or required Narcan after exposure, maybe to intact skin or even compromised skin, had an overdose of fentanyl. Maybe you could speak to that and sort of dispel that myth.
Yes, I think that, and I've been asked this question a couple of times in the past too, it's not sufficient just to have contact, say, with fentanyl on the skin to lead to an overdose. You really need to ingest it. That is, take it by mouth in the form of a pill, inhale it, or inject it intravenously. So skin contact is very, very unlikely going to lead to an overdose and death.
Right. Well, I want to thank you for a very informative interview. I don't know if you have one or two pearls you'd like to give our audience as a takeaway.
Well, I would say two things. One is, don't give up if you have chronic pain, because there is hope. We have non-opioid treatments that can be effective. And two, also don't give up if you have a substance use disorder. Talk to your primary care doctor, talk to emergency room physicians if you're in the emergency room. SAMHSA is a good resource too. The Substance Abuse and Mental Health Services Administration has an 800 number for support and a website. Take the opportunity to use the resources that are available.
Well, I want to thank you very much. That's very helpful. And thank you for joining us and for your wisdom adding to the opioid crisis. Thank you again.